and all present here. Breast cancer is one of the most common cancer diagnosed in women. Recent studies state that it is the second most common cause of death from cancer in women around the world. Today, we have gathered here to spread awareness about breast cancer and to show the importance of regular screening for early detection and improved treatment of breast cancer. Before we move on with today's program, and to start off with an auspicious note, we will now have the lamp lighting ceremony. I request the dignitaries to come forward and light the lamp.
ऐगिरि नन्दिनि नन्दितमेदिनि विश्वविनोदिनि नन्दनुते गिरिवरवि
I now call upon Ms. Akshada, lecturer, Department of Medical Imaging, to welcome the gathering.
Good morning, everyone. A warm welcome to everyone present here. I'm extremely delighted to get this opportunity to address you all for the event of role of mammography in breast cancer imaging. I would like to express my sincere gratitude to our respected Dean Sir, Dr. Mallikarjunaiah. We welcome you, sir. I also welcome our beloved principal, Dr. Nupur Sinha, for the constant support and encouragement. I heartily welcome Dr. Guru Suhas, Chief Operations Manager, and Dr. Javedia, Indian Cancer Society, for all the support they have lended to make this event possible. A very special welcome to our guest speaker for today, Dr. Soumya, surgical oncologist, for accepting our invitation. We welcome you, ma'am. We would also like to extend a warm welcome to our next speaker for today, Ms. Ramya, clinical in charge, Department of Radiology. Thank you, ma'am, for gracing us with your presence. Lastly, I welcome all the faculty members and our enthusiastic students, and thank you all for the active participation. Thank you all.
Thank you, Ms. Akshada. I now request our beloved Dean Sir to kindly speak a few words.
Good morning, everyone. I hope you all are not tired after the rally. At this outset, on the day where we bring the awareness of the breast cancer, the dignitaries on the dais, the principal, Dr. Nupur Sinha ma'am, the speakers of the day, Dr. Soumya and Ms. Ramya, and also the representative from the Indian Cancer Society, Dr. Guru Suhas, and the faculty members and my dear students. Morning, I was addressing, and when we began the rally, I was talking about the awareness. The moment you think about awareness, we believe that the awareness about the breast cancer is the topic to be discussed. Why? Because there is a lack of awareness. So when we do an awareness, when there is a more of advertisement in the TV, when that doesn't happen what it was supposed to be, but we try to bring the awareness. By doing so, we are trying to eradicate or to prevent or to treat the most unaddressed areas in the healthcare practice. And it is very nice to see that all of you have dressed in a pink today. Can anybody tell me why the pink? Why the color pink? Why we have chosen the color pink? Anyone? Anyone from the students? Why the pink? Pink symbolizes what? Pink, there has to be some symbolic representation, right? Why? Anybody? Why we would have dressed red? Red for the rose. Usually the color what usually the many women or the girls they like, red, rose. Why pink? Anybody from the students, tell me why most of you are dressed in pink today. It symbolizes what? What exactly it is? Anyone? Anyone? Yeah, anybody? It represents the cancer. Anybody else? Good, very good. What's your good name? So he has attempted to give that represents the cancer. Anybody else? Anybody else to be more accurate? Yeah, you can use technology. Google is there. Why pink on the breast cancer day? You can think of it. Yeah. Fight for? That's wonderful. So anybody else wants to add up? Why pink? See, you all, the teacher said, sir, we all are wearing it. There has to be some significance, right? That we do celebrate different days during a different, months in a year. The 9 days we wear a different color. Why pink today was the question. So as he rightly pointed out, it represents the woman and represents the healthcare awareness which brings and fights against the most dangerous cancer. The terminology earlier, when it was coined, or it is said to be the word cancer, which is said to be in a different terminologies, the moment somebody hears about the cancer, they believe that it is most dangerous. And which sometimes it says that it is untreatable, not treated. At later stages, it's very hazardous, even fatal. But the technology, the medical technology has evolved to such an extent that major part of the cancer can be treated if it is diagnosed early. So without wasting much time, because you are waiting to hear from the speakers, wishing you all the best and the fruitful session ahead in terms of bringing the awareness on the breast cancer, as it was rightly pointed and mentioned, the role of mammography. It is one of the investigatory procedure to identify, other than the palpation method, which is commonly used as a clinical detection tool. So other than that, how to identify, how this identification can bring a change in the disease progression. I hope all of you take this knowledge which will be given to you, shared to you from the field of the experts they are. So we, from Acharya Institute of Allied Health Science, we welcome all the dignitaries, and also I would like to thank Indian Cancer Society who have come forward and made this event so successful and joined the hands with Acharya Institute of Allied Health Science. Sir, we really thank you for coming to our campus. And at this moment, as a head of the institution, we also say and pray that, sir, we look forward to conduct such more events, maybe into the larger extent of the public is concerned. Please come up with any of the proposal. We are ready. What you are seeing, the students of AHS are hardly 10% or the 15% of the students. We are ready to do any of such events which brings the awareness among the public and also the healthiness which creates among the society. And we are okay to go ahead with the next step to have a memorandum of understanding to come up with any of the events which will gives a thought-provoking message to the public to bring the awareness on any of the diseases which is related to human being and is mankind. And at this moment, I would like to congratulate again the team of Medical Imaging Technology Department who have come forward, and the students of AHS, and I wish to all the students to have a fruitful session ahead. Thank you.
Thank you, sir, for your delightful words. It gives me immense pleasure to announce again that we have among us the Indian Cancer Society. The Indian Cancer Society, founded in 1951, is a non-government organization built to create awareness for detection and for providing treatment for cancer patients in India. I now request Dr. Guru Suhas to enlighten us with his few words.
Good afternoon, everybody. Am I audible? Yeah, at the outset, I'd like to thank and appreciate the entire college and especially the Department of Medical Imaging for organizing such a beautiful program. And sir has laid a path now. So he has spoken about awareness, and also he has told that extend his collaboration for further events also. In this context, as Indian Cancer Society, our main mission is to create awareness, facilitate early detection, and also support the patients. So as a part of awareness program, we would like to create many cancer literacy champions. You are all today becoming cancer literacy champions by knowing about the disease. So by end of this day, you will know about, when it comes to awareness, we always talk about prevention and early detection. Prevention is nothing but knowing the risk factors. All the majority of the cancers have certain things called as modifiable risk factors and non-modifiable risk factors. And then when it comes to detection, screening helps in early detection. So cancer is not a deadly disease anymore. There are multiple opportunities, multiple treatments available now. So if the disease is caught early, better chances of survival, and the quality of life is also very good. So by end of this day, from Indian Cancer Society, we would request you to become our cancer literacy champion by knowing about this early signs and symptoms of breast cancer and also the risk factors for breast cancer, and educate this to your near and dear ones. Not only knowing, please pass the message on. So with this, I'll conclude my speech, and I know you're all looking forward for the lectures. Thank you once again. Thank you one and all.
Thank you, sir. I would now like to invite Dr. Soumya, a surgical oncologist at HCG MSR Center, currently working as assistant professor at Ramaya Medical College, to begin with the session. I welcome you, ma'am.
I'm very happy that I've been invited to talk here on this breast cancer awareness. Thank you, dignitaries from Acharya Institute, from ICS. This month, October, is dedicated as Breast Cancer Awareness Month. It's an annual push to bring awareness regarding breast cancer, its early detection, the benefits of early detection, because early detection causes high cure rates. It also is to educate the people regarding the implications of breast cancer after its diagnosis and the treatment regarding the breast cancer. So I'm here to tell you about the breast cancer, not to scare you about the cancer, but to tell you how it is curable when detected in an early stage. It's no longer a life-threatening disease. It can be cured when it detected in stage 1 or stage 2. The cure rates are almost more than 90 to 95%. So coming to what is cancer? So our body is made up of normal cells. So at a constant rate, there is mutation going on in all the cells. And body has mechanisms to repair these mutations. So sometimes when the mutation happens, the body repairs those mutated cells, or those cells die so that those mutation doesn't cause the changes in cancer. But by chance, sometimes some of the mutations are not repaired, or they don't die and they change into cancer cells. So these cancer cells gain the ability to divide uncontrollably. Like you see, normal cells has a limited number of divisions, but the cancer cells has unlimited number of divisions, and then they slowly divide and form the tumor cells. This is what is cancer. What is breast cancer? Similarly, the breast ductal cells undergo mutations, and then they go uncontrolled division of the cells, which causes breast cancer. And this breast cancer is a type of cancer where it is on the surface, where the tumor can be easily detected in the early stages, unlike in the ovarian cancer, which is inside the abdomen, which can't be detected in early stages. Usually there they present in late stages, but breast cancer can be detected in stage 1. Even when it is 1 or 2 centimeters, the patient herself can detect it. So that is one advantage of breast cancer, why we stress so much on early detection, because it is easily accessible by the patient themselves, and they can detect themselves in an early stage. So coming on to few of the breast cancer facts. As we know, it is the most common cancer in women worldwide, with more than 2 million women being diagnosed with breast cancer each year. And it is a second leading cause of cancer death after the lung cancer. So coming on to the incidence, In India, 1 in every 24 to 26 women are diagnosed with breast cancer. That is the incidence. Compared to the West, where 1 in 8 women are diagnosed, the chances are higher in the West than in India. This incidence of 1 in 24 to 26 is in urban women because of lifestyle changes, compared to the rural women, where the chances are 1 in 64 women. So this is how the cancer incidence is spread across the states in India. The highest incidence, that is say more than 40 per 1 lakh women, are seen in states of Punjab, Andhra Pradesh, Telangana, Kerala and Karnataka. So the average incidence is around 31.3 per 1 lakh women every year. So coming on to the risk factors. What are the risk factors? As Dr. Guru said, there are modifiable and non-modifiable risk factors. The modifiable risk factors are the factors which can be, we can modify those factors to reduce the risk of breast cancer. The non-modifiable are, as cancer is a disease of elderly, the older the age, the chances of having cancer is higher. So you can't modify the age as a risk factor. The onset of menarche and the menopause, this tells us that during your reproductive age, the body's estrogen is higher. Estrogen itself is a cause for breast cancer. The breast cancer cells have estrogen receptors, which increases the risk of breast cancer. So earlier the age of menarche, later the menopause, the longer the reproductive age, the more chances of breast cancer. So this is also one of the non-modifiable risk factors. Gender itself, woman has a higher risk of breast cancer. That doesn't mean male don't get breast cancer. The chances of woman having is 100 times more than a male. Then your family history is also a non-modifiable risk factor. You should know your family history, how many first degree, second degree relatives. You can talk to a genetic counselor or an oncologist if you feel you have a strong family history of breast cancer. Then they will detect your lifetime risk, and then that will help you in when to start your screening for breast cancer and early detection. So some of the modifiable is lifestyle changes like addictions like smoking, alcohol, all these are modifiable things. Use of oral contraceptive pills which contains the hormones. Then radiation exposure like occupational radiation exposure, obesity, physical activity, maintaining a healthy body weight, all these are modifiable risk factors. Like I said, the modifiable risk factors are the ways to reduce your breast cancer risk. Smoking should be avoided, avoid alcohol, control your body weight, limit alcohol, breastfeeding. As I said, estrogen is a cause for breast cancer. The more you breastfeed, the lesser the estrogen levels, and that reduces the breast cancer risk on itself. So at least 1 to 1.5 years per child is advisable to reduce your breast cancer risk. Be physically active, avoid radiation exposure. So coming on to breast cancer screening, I'm going to limit my talk to screening and awareness itself, not go into the details of diagnosis and treatment that I can get during the question and answers round. So in screening, the three important thing is self-breast examination, clinical examination either by a breast surgeon or an oncologist. The third is the screening mammography. Screening mammography, I think Dr. Ms. Ramya will talk in detail about it. Coming to self-breast examination. So what do we do in self-breast examination? First, it must be done either, the two components is, first is inspection. Once a month, try to notice the size, shape of your breast, the consistency of your breast. Look into a mirror, see how normal your breast is so that you can detect if there is any abnormality in the size, shape, the skin changes, any discharge from the nipple. So this inspection is important. This is followed by feel how your breast feels every month. Either you can do in lying down position or in standing position. Look for the normal consistency of your breast and then look for any changes, any new lumps, any skin changes. This should be ideally done once a month, and don't try to look for anything too much into it also. Just be aware that any hard lump, painless, which is slowly growing, is a dangerous sign. And also you should know that most of the lumps detected, 90% of them are not cancerous. So when you find a lump, don't panic thinking that it is a cancer. Go to a clinician, go to a doctor, show it. In younger ages, say in 20s and all, 90% of the lumps are fibroadenomas, which are not cancerous at all, and it is not life-threatening. Doesn't mean that you should not show a clinician thinking that it is not cancerous. So as soon as you find something, better go to a doctor and show it to them. So most young women are unaware of the possibilities. Initially, the breast cancer was the disease of 50s to 70s. But nowadays, we are seeing cancers which are coming in early 30s or in late 20s also. So you should be aware that any lump should be shown to a clinician, no matter if it is benign or malignant, the doctor will decide for you. So self-examination is just a tool to increase awareness so that people will detect the cancer in an early stage. Clinical breast examination. So when you find something abnormal in your breast, go and show it to a clinician. So clinician will have a better evaluation of your lump or whatever symptoms you're having, so that further evaluation can be done depending on what the patient is presenting. Thirdly is a screening mammography. So this is an investigation which consists of two things. One is an ultrasound, one is an X-ray. So ultrasound is an operator dependent, and they'll see what are the changes in your breast. X-ray is also a simple X-ray which will detect if there is any abnormal tissues in your breast tissue. So coming on to what are the 5 steps for early detection of breast cancer. As I said, monthly breast examinations. In monthly, if you are in a woman in a menstrual, if she's in a reproductive age, it is better to do this self-examination on the 5th to 10th day after your menstrual cycle. If postmenopausal, you can fix one day of the month to do your examination. Once a month is enough to do. Next is know your risks and family history. That means know your modifiable, non-modifiable risks. Know your family history. How many people in your family, how many your mothers, sisters, women who had breast cancer, so that you can talk to a genetic counselor, assess your lifetime risk. What is your lifetime risk of breast cancer? Through that, you can go ahead with whatever screening procedures depending on what your lifetime risk is. Then visit your doctor regularly. Know when to get a mammogram. Ideally, in an average risk woman, we recommend to start mammography at 45 years of age. If we think that the patient has high risk, like they have a strong family history, maybe they have a genetic mutation like a BRCA1 or BRCA2 gene mutations, then we recommend earlier, maybe at 35 to 40 years, and also decide whether to get X-ray or to get ultrasound depending on the age of the patient. Then also follow up after screening or the test with a clinician is more important, because they will be able to tell you what the report is. Some of the myths and facts related to breast cancer. So if they say that I don't have a family history, I won't get breast cancer. This is a myth, because anybody, anytime can get breast cancer. Only 10% of breast cancers are related to familial history. The rest of 90% of people get it by chance. So it doesn't mean that you don't have family history, that I don't get breast cancer. Then if there is a lump in my breast, I have cancer. I already stressed on this. Not all lumps in the breast are cancers. Almost 90% of lumps are benign. The older the age, the chances of being it in a cancer is more. So you shouldn't be scared that I have a lump, I have cancer. Then I am too young to get breast cancer. This is what I said about almost 1/4 of breast cancers we see are less than 50 years of age. A tight or a underwide bra increases the risk of breast cancer. No, there are no studies which have said that wearing a tight bra or a bra at the night, none of this have shown to increase the risk of breast cancer. A mammogram can cause cancer. This is also a myth. A mammogram is an X-ray which is very low dose radiation. The benefits of detecting cancer outweighs the benefit of it causing cancer. So mammography is a good tool, shouldn't be avoided thinking that it can cause cancer. Only women can get cancer. This is also a myth because men can also get breast cancer. Doesn't only thing is the chances of getting male is less. Doesn't mean that men cannot get breast cancer. The good news is because of increasing awareness, because of better screening, early detection, and improving treatment options, the death rates of breast cancer has reduced since the 1990s. Even though the incidence is higher, the cure rates and the complete recovery is much better compared to the earlier days. So the motto for today is the breast cancer is a highly curable disease when diagnosed in an early stage. So do not have the stigma that I have cancer, I'm going to die. So stage 1, stage 2, I have seen patients come up to 10, 15 years of follow-up being normal after treatment. So it is best to spread the message to your near and dear ones. Once diagnosed cancer, do not have the stigma that cancer is not curable. Cancer is absolutely curable. Thank you so much.
Thank you, ma'am, for your very informative seminar. Our next speaker for today is Ms. Ramya. She has completed a bachelor's and master's in radiology and imaging technology, and she is currently a clinical in charge in Department of Radiology at Saptagiri Institute of Medical Science and Research Center. I welcome you, ma'am.
Good afternoon, everyone. I am Ramya from Saptagiri Medical College. I am working as a clinical in charge and mammography technician in Saptagiri College. Today I am here to talk about mammography, how the procedure is going on, what the patient feels when they are undergoing for the mammography procedures. This is the mammography equipment which we are going to use for the mammography procedures. What is mammography? So mammography is a radiological imaging technique or the modality which is used to detect the breast pathology or the breast cancerous tissues. Then a mammogram can find breast cancer when it is very small, then 2 to 3 years before the symptoms of the breast. Then approximately 1 in 2 women in India will have develop the cancerous in her lifetime. No screening tool will not be 100% effective, but mammography will give the around 80 to 90% of the early detection of the cancerous cells in the breast. Sometimes cancers are not found until they get the symptoms or it is in a micro measurements or in a micro sizes. So here we have the standard techniques used for the breast imaging are screen film X-ray mammography, that is mammographic procedure, the equipment which I have shown you before. Then real-time ultrasound, that is as a complementary for the mammography. Then other new techniques are MRI, then color Doppler imaging, then contrast ultrasound techniques, digital mammography equipment, then scintigraphy. So scintigraphy, it is nothing but the radioisotope. It will be injected into the patient body to evaluate the breast cancerous, and it will help to find out whether is the lesion is malignant or benign, and instead of the breast biopsy. So coming to the development of the mammography. So in 1913, radiographic appearance of the breast cancers was first reported. Then in 1950, industrial grade X-ray films were used for the mammography. In 1975, high speed and resolution films introduced by the DuPont. Then in 1992, they introduced the quality standard acts in the mammography. Then coming to the principle of the breast cancer, if we find out the breast cancerous in the early stages, the patient will be responds to the treatment very well. Then the earlier diagnosis is the better chances of survival if you did the mammography for the early detection. Then if the patient is in advanced stages, after that if you do mammography also, the patient will give the response very less to the treatment, or they will perform very poorly response to the treatment. Then what is the indication for the mammography? So which patient or who can undergo for the mammography is painless. If the patient is having any pains or tenderness and swelling in the breast, then nipple discharge like any pus or blood or any white discharge from the breast also can be considered as an indication for the mammography. Then calcification in the breast, then benign or malignant tumors. If the patient is undergo for the physical examination, as madam said, once in a month, or any patients finds that they are having a lump on the breast, they can go for the mammography screening. And lymph node enlargements. So what is the contraindication for the mammography? So who should not undergo for the mammography? Breast implants and severe nipple discharge and large palpable mass and inflammation in the breast, and women with the reproductive age of 15 to 40. In the reproductive age also, we have to consider whether the mammography is benefit or risk for the patient. For example, if the patient is not having a breast lump but they are feeling pain in the breast, that time we should not suggest for the mammography until and unless it is confirmed in the ultrasound. Then how the patient preparation for the mammographic procedures? Instruct the patient to come with a proper, to take a proper bath before coming for the procedure. Then patient should not wear any deodorant or the talcum powder or any lotion under the arms or under the breast, as they may appear on the mammographic images. It will be misinterpreted on the mammographic films. Then she used to suggest the loose clothings. It will be helpful to change the dress for the procedures. Then she is asked to bring the any histopathological reports. She has undergone for any previous medical reports. Inform the patient to bring those old reports. It will be helpful to correlate with the clinicals. Then a green hospital gown is provided for the patient. It will be helpful for the mammographic procedures. Then patient privacy should be maintained and conducive environment should be created, because the patient will be having the fear that mammography will be more painful procedures. But being a radiographers and female technologist, you can instruct the patient about the mammographic procedures and inform the patient it is not a that much painful procedure. Okay. And breast cancer screening. Here the woman who is under the 40 to 49 age should have a early every year, alternate year, they have to undergo for a mammography. If the patient at the 50 age, they should go once in a year for the mammographic procedure, even though if they doesn't have any symptoms. If the patient is having any symptomatic, they can undergo for the mammography after consulting the doctors. Next, risk factors. As madam explained that increases with the age. After the 50 years, more patients will be having chances to get the mammography, get the breast cancer. So it is better to go once in a year for the mammographic procedures after the age of the 50. Then family history. If the patient having a family history of breast cancers or any other cancers, it is better to undergo for the mammographic procedures. Then women with a positive family members are prone to more for the breast cancers. Then coming to the anatomy of the breast. Okay, vary in shape and size. Cone shaped with post surface overlying pectoralis and serratus muscles. Then axillary tail extends from the lateral. Then base of the breast to axillary fossa tapers anterior from the base ending in the nipple and surrounds by the areola. Then female breast consists of 15 to 20 lobes divided into several lobes. Then lobules contain acini, draining ducts and intralobular connective tissues are present. By teenage years, each breast contains hundreds of lobules. So this is the anatomy of the breast. You can see the various muscles and mammary glands, lactiferous ducts, areolar glands and areola, and nipple and areolar tubercle and lobes of the mammary glands. So we'll come to the type of the mammographic examination. So there will be a diagnostic mammography and a screening mammography. So diagnostic mammography will performed for the symptomatic patients, and screening mammography will perform for the asymptomatic patients. In diagnostic mammography, we are having two views for each patient. One is the craniocaudal view and another one is the mediolateral oblique view. So modern equipment consists of specialized X-ray tubes and optimized screen film detector system, breast compression devices. So in mammography, we are using the low KVP technique. As the breast is a soft tissue, the low KVP techniques is preferred instead of high KVP techniques. So here low KVP techniques is used because to help the minimize the Compton scattering. I hope all the BSc students will know about the Compton and photoelectric effect. So Compton scattering, if it is minimizes the Compton scattering, the image quality will be good, and maximize the photoelectric effect will gives the better image quality, and it will be enhances the differential absorption by the various tissue of the breast. Then as a glandular tissue of breast is highly radiosensitive, and low KVP helps to reduces the radiation dose to the patient. So if you use the low KVP technique, it will be helpful for the patient for the low radiation dose. Then we'll come to the equipment of the mammography, that is target. It is made up of a molybdenum or rhodium. We can use a tungsten also, but tungsten, due to high atomic number, we can get a more energy of the X-ray photons. So molybdenum and rhodium is having a low atomic number as compared to the tungsten. So it is better to use the molybdenum. Then it will produce as the characteristic X-rays. Then we are using the up to 20 to 35 kVp were used for the mammography, not more than 40 kVp. Then target and the filters which we will use for molybdenum and the rhodium filters. So for the molybdenum target, we have to use the molybdenum filter itself, or the rhodium target you can use the rhodium filter. But here we are using the molybdenum target and the rhodium filters. If we use the rhodium filters, it will be absorb the scatter radiation from the X-ray tube. Then windows will be glass beryllium or a very thin borosilicate windows will be used, and source to image distance, it will be around 60 to 80 centimeters, which will be helpful to get the better image quality. Then anode angulation will be around 20 to 24 degrees. Tube angulation will be given. If the anode angulation is 16 degree, you have to give the tube angulation around 6 to 8 degrees. Then focal spot will be 0.1 mm and the 0.3 mm. If you use the small focal spot, we can get a better resolution. Then coming to the compression of the breast, where the patient feels more painful when they compress the breast. But compression will be helpful to get a good quality of the mammographic images. So why it is done and how it is done, we'll see. So compression is achieved with a low attenuating Laxan pedals attached to a compression device. So 10 to 20 newtons of the force is typically applied. Then parallel to the breast support table, spot compression uses small pedals. Then principal drawback of the compression is patient discomforts. And more patients will feel that when you give the compression, it is more painful. But give only minimum amount of compression which is necessary for the good radiographs. Then why this compression is applied? Why? Because of to spread the anatomy of the breast, to minimize the overlying structures and improve the contrast on the mammographic film. Then equalize thickness to ensure the homogeneous density on the radiographs. Then bring the structure close to the detector to reduce the geometric unsharpness. So we'll come to the views in the mammography. There are 4 views. Routinely we will perform only 2 views for all the patients, And supplementary, there are many views are there, but we will explain only two here. Routine views are craniocaudal views and the mediolateral oblique views, and supplementary views are cleopatral view or the axillary tail view. Sometimes if the patient is having any inflammation in the lymph nodes, their doctors will suggest for the cleopatral view or the axillary view, then the cleavage view. So this is the craniocaudal view. So here craniocaudal view is done by the 0-degree angulation of the mammographic X-ray tube. Then here that cassette reaches is perpendicular and film tray is the height should be matched with the inframammary. Then nipple in the profile. Then wrinkles and foldeds are smoothed out. Then compression applied. Then marker at the axillary part. So here to place the marker, it is very necessary to identify the axillary and medial side of the breast. And compression should be applied before doing the exposure in order to get a uniform thickness of the breast. Then this is the mediolateral oblique view, and here the CR and IR angle is 45 degree. The cassette and the X-ray tube should be angled for the 45 degree to cover the axillary part of the breast, both axilla and the breast. Here top of the cassette is at the axilla and the nipple should be in profile. Then compression is applied as much as the patient can be tolerable. Then marker at the axillary part. You can see the both CC and the MLO views. So in the CC view, you can see the nipple areolar complex and the corpus mammae. In the mediolateral oblique view, you can see mainly the pectoralis major muscles, which will be helpful to identify the lymph nodes inflammations or any enlargement in the lymph nodes. So this is the upper and lower quadrant we can see in the mediolateral oblique view, and the outer quadrant and the inner quadrant in the craniocaudal view, which will be helpful to diagnosis and explain the mammographic procedures. Then cleavage view, it is the modified craniocaudal view that improves the visualization of the area between the breast. Both the breasts are positioned on the detector to visualize the area between the breast. So here 0-degree angulation of the tube will be takes place, but both the breasts are kept at a time on the detector. Then axillary tail view, cleopatral view. So why it is done axillary tail view? Because to evaluation of the breast and tissue more lateral, which is more laterally oriented, and to see evaluate the lymph node inflammation or any lymph glands are involved in the breast cancer, breast carcinoma, and demonstrate entire the axillary tail part. So you can see the various views of the mammography, craniocaudal view, then axillary tail view, then tangential view, then extended craniocaudal view, everything. So these are the various mammographic views which will be performed. Only two views are mainly performed for all the patients, craniocaudal and the mediolateral views. If the doctor suggests to go for the axillary tail view and the cleavage view, we can be performed that also to identify the disease or position of the lesions. Then spot compression views. So this spot compression view will be helpful for the evaluation of the margins of the lesions and morphology of the lesions. So only the compression should be applied on the where the lesion is present to identify the morphology of the lesions. Then it will be spread the structures useful to determine the density variations, and if the lesion whether it is real or it is a summation of the shadow appearing on the images in the craniocaudal view, we can be able to find out. So this is the spot compression view. Then magnification views. Magnification views will be performed where the patient is having a calcifications, then any architectural distortions. And if the lesion, they want to find out the margins, whether it is a satellite lesions or any microcalcifications are present in the breast lesions, we can perform the magnifications views by using the magnification stands, and upon the magnification stand, the breast should be placed and compression is applied. Then coming to the BIRATS category, which will be help to assessment of the breast cancers. Then category 0, that is BIRAT 0, it is incomplete. The patient does not have any breast cancerous tissues. Then category 1, it is a negative or the normal breast tissue. Then category 2, it is a benign findings in the breast. Then category 3, there will be a probably benign. That is, if the lesion is found in the tissue, but the doctor cannot confirm whether it is a benign or the malignant. So they will say that it is a probably benign. And for category 4, that is BIRATS 4, it is suspicious abnormality. And category 5 or the BIRATS 5, it is highly suspicious for the malignancy. And category 6, known for the biopsy and with prone malignancy of the breast. Then coming to the gynecomastia, it is nothing but the benign male breast conditions. So if the male patient is having any lump or any changes in the breast, it will be called it as a gynecomastia. Then some men who is having a prominent breast or uneven breast often feel some embarrassment about their body images. They can undergo for the gynecomastia or mammography. Then this condition also causes emotional conflict over the sexual identity. Then common causes for this gynecomastia is puberty, hormonal growth and the changes during the adolescence, and estrogen exposure, female hormones present in the body and the environment, and androgen exposure, bodybuilding hormones, then medication side effects. Then on symptoms of Klinefelter syndrome, a condition where the male will be having an extra X chromosomes. So this is the male breast they are going to do for the mammography. You can see CC view they are performing, and they are doing the mediolateral oblique view for the male breast. Thank you.
Thank you, ma'am, for sharing your knowledge with us. We would like to extend our gratitude towards our guests for today with a memento. I now request Mr. Arul, Assistant Professor, Department of Medical Imaging, to propose the vote of thanks.
A very good afternoon to the dignitaries on the dais, staff and dear students. This event will not be complete without thanking each and everyone involved in making this event as a success. I would like to express my gratitude to our respected chairman, Mr. Premnath Reddy, our executive director, Mr. Shalini Madam, and our executive secretary, Mr. Bhushan sir, on their absence. I wanted to thank our respected Dean, Dr. Mallikarjunaiah sir, on his tremendous insights and valuable presence on this occasion. And I would like to thank our beloved Vice Principal, Dr. Nupu Sinha ma'am, for all her support and encouragement. And I wanted to take a moment and say thank you so much, Dr. Guru Suhas sir, and the Indian Cancer Society, not just for involving in this event, but also for the service you do fight against the cancer. I express my sincere gratitude to our speaker, Dr. Soumya, for the sharing of valuable insights to our students and staff. I express my sincere gratitude to our speaker, Ms. Ramya, for sharing a valuable clinical knowledge to our students and the staff. I thank my fellow faculty, non-teaching staff and volunteers for aiding in organization of this event. And I thank the maintenance team, housekeeping staff, Mrs. Kalyani and Mr. Brahmaya for this constant support. First of all, this wouldn't have been possible without the team. So a big thank you to my team. Last but not the least, I extend my appreciation to all students for their presence in making this event a successful one. Thank you so much to everyone.
Thank you, sir. We have now reached towards the end of today's session. I would like to get your feedbacks regarding this program. We have pasted QR codes onto the walls, so you all can scan and fill the Google form and give us your feedbacks. Thank you all and have a great weekend.
So there is a stigma in this society that you don't have to talk about things, right? There are things that matter, right? So once we talk about these things, the world can be a better place, right? Right? Yes? So we are taking this chance or this opportunity as a young generation. We need to bring up this situation to the world, and we have to make sure that everyone understands what is breast cancer. Got it? So breast cancer is one of this type of cancer which has been there for a long time, and back in 1990s it was ranked as fourth in India as a top type of cancer. Now it is in the first place, right? It is all because we don't know what is breast cancer. Of the generation which is older than us, the baby boomers, they don't know what is breast cancer, right? So we are here so that we can spread awareness on this, and I would like to thank our beloved Dean sir for giving us this opportunity, right, to hold such an event from our end, from Acharya College of Allied Health Sciences. And I would also like to thank Indian Cancer Society for showing their support towards initiation of this program. Now I would like to invite our Dean sir to address this gathering and start the program. Thank you so much.
Good morning, everyone. I should hear good morning so that the entire Acharya campus will hear the good morning, and so that they will come to know that there is some event which is happening from AHS. The moment I say good morning, I should hear louder good morning. Is that clear? Yes, sir. Good morning. Good morning, sir. That's great. So that's the spirit I want, because at this outset, let me tell you that as consideration from Acharya Institutes and Acharya Institute of Allied Health Science, I would like to welcome Indian Cancer Society, who had come forward and taken this opportunity, as well as taken the pride to bring the awareness about whatever the breast cancer, which is not said but it is felt. It is what it says. So they have come forward to make this program and bring the awareness among the common public. So that is my first thanks to the entire team of Indian Cancer Society. A big round of applause for them. And along with that, we have speakers from MS Ramaya, who is here, and one more speakers from Saptagiri Institute of Medical Science. They will be joining us. So it gives an immense pleasure as a part of Acharya Institute of Allied Health Science to host such programs and to witness such programs in building the better nation. As a healthcare professionals, it is our responsibilities. I would say it's our roles and responsibilities to make or commemorate such kind of events, so that it will bring some awareness and brings a healthy India. That is what the 2030 mission looks like. And healthy India, that is what they consider for a future generation. And it is our responsibilities as a part of healthcare professionals to take it forward for the better nation. That is what we look forward. With this kind of theme and with this kind of the program what they have come up with, the faculty, the Department of Medical Imaging Technology, I would like to congratulate and give a big round of applause to Department of Medical Imaging Technology who have come forward. Along with this, to witness this, we have an entire team of faculty who had come here and who have been promoting the event and thereby helping the students to understand what this awareness is all about. I would like all the students to give big round for even the faculties who have joined here. Last but not the least, without the students, which is sometimes it is highly impossible to hold such events, and without the students we are nothing, and you are the future for the healthcare professionals, and you are one of the person who is responsible to identify and to properly advise the society that what is required for the future. Provided, you never know, we are bunch of 100 today or maybe 150. You never know. If you can change the people's attitude of at least 10-15 of the public, it is a great adventure, I would say, rather than telling that it is your duty. And with this pride, you can say that to the public that what all the disadvantages and what all the complications, sometimes it goes unnoticed or they fail to address in a common public. So by doing this, you also should understand the ethics, the way you are supposed to communicate the people that what exactly it is. I mean to say what exactly this awareness is all about. if you start understanding, the moment you tell this to 10 people, the message spreads along the society so that the people start knowing about what exactly the breast cancer is all about. Sometimes it becomes, a different situation or embarrassing moment for a patient to express themselves that what is happening. But nevertheless, it is a part of the body where you have to respect and you have to treat that in a good way, in a dignified manner. So there is an ethics, what we call it as a professional ethics, or what we call it as the diligency, the perform, the how you meet the demands of the society. The first thing what you are doing today is the awareness. That is the most important, which is required nowadays. Sometimes we have seen many of the articles rather than seeing patients. In such cases, we see many of the articles. Even he pointed out, the Swapnil pointed out the percentage of people suffering from it. Many of them, they've come with the later stage. I'm not technically sound in terms of dealing with such organs, but nevertheless, when the patient starts identifying, it should not be a late. It should be an early identification, which can be completely curable and can live a successful life. With this thought-provoking words, I would appreciate, congratulate, and acknowledge what you are gathered here, and I wish you have a wonderful day on this day. And again, I thank Indian Cancer Society to sponsor all these things and come forward to bring the awareness among the budding allied health professional. Thank you, one and all.